institution of health. We're looking at the institution of health. We're done with, so I won't be able to see my screen. I mean, to see what's happening in the room, because as I will be taking you through the slides, I will leave the room and go to my slide presentation. So if there's like reaction comments, it's going to be difficult for me to see. But from time to time, I'll come back and check. But like I've indicated, if you have something to say, just unmute. At least it will be easy for me. I'll be able to stop and listen to whoever would like to say. So I'm going to go to my slides now. Yeah, good morning once again for those that just joined. So as I've indicated, we're looking at the institution of health. Before we can go further, as usual, we're going to look at an overview of this theme, or rather the learning outcomes. So at the end of this theme, which is the institution of health, you have to be able to define the key concepts and provide examples specific to South Africa. We are looking at the South African context. And then you should be able to discuss traditional and Western medicine. We're going to look at that. You should discuss the health and you should discuss the healthcare system in South Africa. And you should be able to distinguish between the different standpoints offered in the theoretical perspectives presented. So as usual, we will refer to the theoretical perspectives that are relevant for this theme, so that we can be able to use such theories to explain the institution of health. So just a brief explanation in terms of health and illness. What is it that we're talking about when we talk about health and illness? So when you talk about health and illness, it basically relates to how individuals and groups relate to health and their well-being. So we're basically looking at the question of mortality rates and life expectancy. Mortality rates as in the number of people that dies, and then also life expectancy with regards to the age number that is expected for individuals to look up to. And I think in South Africa, the life expectancy is around the age of 65 or so. And this also relates to the retirement age. But with regards to retirement age, it basically depends on various organizations or various companies based on their policies to say, okay, according to our policy, the age of a person to retire, it can be 65 or 60, maybe for men 60, for women 65. And even some companies or organization will say it depends on the skills that the person is offering. If it's scarce skills, then the retirement age might differ. So it basically depends on such various organizations or companies in terms of that retirement age. So life expectancy, that's what we're looking at the age number of an individual in terms of at what age are they expected to live. And then also it has been indicated that the life expectancy in South Africa, it's sort of decreasing. And then the number of mortality rates, especially the infant mortality rate, the number seems to be increasing. The number of kids that are dying, the infants that are dying when they are being born, and stuff like that. And then again, as I've indicated, that we're going to look at the various sociological perspective. So when you talk about health and illness, this is looked at through an analysis of sociological perspectives and different issues that relate to inequality in health from a South African point of view. Again, in this context, we're going to look at South Africa, as it indicates there that different issues that relate to inequality, we will focus more on that when we talk about the Marxist perspective or the conflict perspective. Remember, with the conflict perspective, they always refer to how various institutions in the society perpetuate such inequalities. Okay, let me quickly go and check if there's any reactions. Nothing yet. Okay, moving right along. So now we're looking at the traditional versus Western medicine. Traditional and Western medication. So both the traditional and Western medication, they serve various purposes in individuals' life. Us as individuals in the society, we have our preferences. There are other people that prefer traditional medication compared to the Western medication. Others prefer Western medication compared to the traditional medication. It just depends on an individual. So there are various factors that actually influences our decisions, whether we decide to prefer traditional or Western medicine. So both the Western and the traditional medicine, they have their strengths that differ based on several factors. So such factors, we're looking at the issue of affordability, accessibility, effectiveness for certain diseases, patient comfort, and certainty with diagnosis and treatment. So in terms of affordability, as I've indicated, that one would prefer either traditional or Western medication. Some people would say, okay, I prefer the traditional medication because it is affordable. And also the World Health Organization, yesterday we spoke about the World Health Organization as one of the organization or institution that has the global impact when we spoke about when we were looking at politics as an institution. So we're also going to delve much into that just now when we speak about World Health Organization and when they were facilitating COVID-19 as a pandemic and all those things. So the World Health Organization reported that traditional medicine have large public health impacts throughout the world. To say that many people throughout the world, they are opting for traditional medication, and this is due to some of those factors that I've indicated. Now, I spoke about affordability to say that different individuals prefer, let's say, traditional medication because of how it is affordable. To say that maybe if you are an individual, you cannot be able to afford the Western medication, you cannot be able to afford medical aid and go to the doctor, set an appointment, go to the doctor, or even go to the private hospital to get the necessary healthcare services, and therefore you will decide to opt for the traditional medication because you would be of the view that it is affordable. And we're gonna talk about that shortly in terms of the private and the public healthcare system and such inequalities that it brings in the society. So yeah, with regards to affordability, is that issue to say, okay, I would prefer traditional medication. Maybe you've been using, and also just to emphasize that oftentimes individuals combine the two medicine. Some would combine the two to say, I'll still go to the private hospital or even the public hospital, but at the same time, I'm gonna opt for the traditional medicine. When I feel sick, I'm gonna consult the traditional doctor, or is it a sangoma? It depends on individuals. And then if you are using both to medication, at the end of the day, you will come to the conclusion to see that, okay, I can actually afford this one is more expensive, based on your reasons. And also now the other factor is accessibility. Accessibility in a sense that other individuals would say that traditional medication, it's more accessible, that when you're an individual, then you feel sick, you'll just feel like, okay, let me just go and consult the traditional healer across the street. Then it's more accessible for you, meaning it saves time, it is less of a hassle compared to if you would want to access the Western medication. Because oftentimes when you go to, especially in terms of the public healthcare system, you'd go to the public clinic, there are long queues, and then when you have to go to the doctor, you have to set an appointment. Sometimes even at hospitals, there are those chronic illness. If you find yourself in a situation where you have a chronic illness, then you have to go to hospital. Then if they need to do a certain procedure to assist you with that illness, then they will put you in a waiting list to say, okay, you are in a waiting list, therefore you'll come within a month or 2 months. And so in a way, it sort of delays you while you are sick and while you have to wait in that waiting list to be assisted. And so that's why other people would prefer to just consult their traditional doctors or healers, so that it can save them time and avoid such delays. So that's with regard to accessibility influencing such decision of individuals whether to use both the two types of medication. And then effectiveness for certain diseases. The other reason why people would choose the certain kind of medication as opposed to the other is the effectiveness of medication. One would say, okay, I prefer traditional medication because of how effective it is. And also I was reading somewhere, it was indicated that other people prefer to go to the hospitals in the beginning of their sicknesses just to get diagnosis. Then as soon as they get diagnosis, then they go to the traditional healers so that they can be assisted. And yeah, so effectiveness, again, it brings us back to what we have just spoke about in terms of accessibility. So yeah, it's also one of such factors that leads to individuals to take such various decisions. The issue of effectiveness, to say, for me, I believe that the traditional medication is more effective than the Western medication. But then again, people should be careful in terms of deciding to use such type of medication. And to say, okay, this one is effective, this one is not effective, or even when they combine the two. I remember the other time we were doing a study about, I'll give an example about HIV and AIDS. And obviously when you do research, you interview the participants. And so some of the responses that we got from the participants were that some were mixing the traditional medication that they got from the traditional healers, and some were mixing, they were mixing that with the Western medication, which as a result affected them. So there are such sicknesses that just needs Western medication. You should just stick to Western medication, because other people were of the view that, okay, HIV cannot be cured, and then they decided to opt for the traditional medication, and then as a result, they realized that it wasn't working, and it even made their conditions worse. And then when they have to go to the hospital, they would tell the doctors that, okay, I consulted the traditional healer, I got this medication. Then the doctors did not have anything to do, because now that messed up with their progress of just trying to maintain that disease. And then also the other factor is the patient comfort. Just depending on how comfortable you are as a patient, whether you are comfortable with consulting the traditional healer or consulting the Western doctor. They've indicated that, okay, if you are a patient and then you go to the traditional doctors, some are of the view that, okay, traditional doctors, they give you such comfort, some even can be able to diagnose you and connect with your ancestors, if you believe in ancestors. And so they can be very comfortable around traditional healers, as opposed to the Western doctors, whereby you just go there. And because Western doctors, obviously, they studied medicine, and it's just for the purpose of just diagnosing you with the sickness that you might have. There's no such connection between the doctor and the patient, as compared to the traditional healers, as I've indicated, that it would be that situation where they connect you with your ancestors, diagnosing you and all that. So patient's comfort also, it's one of such factors. And then lastly, certainty with diagnosis and treatment. That also brings us to what we just spoke about now in terms of the patient and comfort the comfort of the patients in terms of how they are being diagnosed, and the treatment that they get after they are being diagnosed, the medication that is being prescribed to them after they are being diagnosed with any sickness. So that's the purpose of the traditional medication, especially because these factors that I've been talking about, they rely more in the traditional medication to show some of the advantages and people's preferences as to why they prefer the other medication or medicine as compared to the other. And as I've indicated just now, that the World Health Organization, they've actually indicated that traditional medication plays such a very huge role in patients throughout the world. And then another thing is that around 40% of pharmaceutical products today, they draw from nature and traditional knowledge. The products that are being sold, the medicine that are there in the pharmacies, the medication that we buy from clinics, they say that some of those, they draw from nature and the traditional knowledge. So now, while we are still on the traditional and Western medicine, during COVID-19, and I also spoke about this yesterday and also indicated that we'll expand more today when we're looking at this theme of health, to say that during COVID-19, there were debates, especially when it started, to say that Lingana, which is also referred to as umhlonyane, I don't know in other language, what is it referred to? Here it says Artemisia afra. So they say that during COVID-19, that herb, the president of Madagascar claimed that it could prevent COVID-19 infection, that umhlonyane or lingana could prevent COVID-19 infection. And also, as that was indicated after the president of Madagascar made such claims, lingana even started becoming very scarce, and people were even selling it with a high price, because now people were of the belief that it can heal COVID-19. However, the World Health Organization, as I've indicated, that it is the organization that promotes health and it has global impact. And remember, during COVID-19, the World Health Organization, it was even giving us updates in terms of the number of people that are infected by COVID-19 and the number of people that actually dies from COVID-19. So they disputed that claim that was made by the president of Madagascar to say Umhlonyane can heal COVID-19, to say that that is not scientifically proven. There's no scientific evidence that support that plant's efficacy, whether that plant is it efficient, the lingana Umhlonyane, whether is it efficient for treating COVID-19. So the World Health Organization has a say to decide which medication is appropriate or not. And the other thing with regards to the Western medication, the other reason why other people could prefer that kind of medication is that it gives them confidence to say that the Western medication is reliable, it has been tested in the labs, it has been scientifically tested, and there's evidence that it is effective and it is safe to be consumed. And that's why other people would prefer just the Western medication. And so, yeah, the World Health Organization did not entertain such claim, although people still continued using that herb as a treatment for COVID-19. But then the World Health Organization was saying, if anything happens for those people after taking such a herb, they did not want to take any blame because they did not release any statement to say, yes, that can be consumed or taken as a treatment for COVID-19. So basically, modern medication, it has that advantage of being tested in the laboratory for diagnosis, and it has been scientifically proven, and hence the reason for some of the people to actually prefer using such kind of a medication. So yeah, that's basically that with regards to the traditional and Western medication. Is there any question before we can move further? Any comment? So now we're looking at the healthcare system in South Africa. We're looking at the healthcare system in South Africa. Can anyone tell me what is the state of the healthcare system in South Africa in your own view? What is the state of the healthcare system in South Africa? Anyone, please unmute. The state of the healthcare system in South Africa. Can you guys still hear me? Maybe I'm talking alone. Hello? Can you guys hear me? Can I please get an indication if you still hear me? Guys, can you hear me? Okay, I see today you guys are just quiet. You don't want to interact. That's the issue with the online teaching and learning. Anyway, I'll continue. So in terms of the healthcare system in South Africa, we spoke about which it's something that we're also going to talk about when we talk about the Marxist perspective, to say that the healthcare system in South Africa is still unequal. It's still unequal, especially in a sense that previously we spoke about the private and public schooling when we were looking at the theme of education. So again, with regards to health, in South Africa, we still have such inequalities. We still have the private and the public healthcare as a system, which somehow brings such inequalities, meaning that all the people doesn't have equal access to health. They don't access health the same way. If obviously you use medical aid, it means that you can consult the private healthcare. You have your own doctor. When you are sick, you go to the private hospital. So that's the disadvantage. And then whereas when you use the public healthcare services, when you use the public hospital, government hospitals, clinics, meaning that your access to healthcare is not the same as compared to someone who's using the private healthcare. And so we're going to delve much into that when we talk about when we get to the Marxist perspectives in terms of how that brings such inequalities. And so there's been talks about implementing the NIH, the NHI, the National Health Insurance in South Africa. So the reason for implementing the National Health Insurance in South Africa is so that they can eradicate such health inequalities in South Africa, so that everyone can be provided with good health care to avoid private and public health care. And so that bill still needs to be signed by the president before it can be implemented, and so it's still in the process. Then the other issue, previously I spoke about COVID-19 just now in terms of how the World Health Organization disputed the claim that was made by the president of Madagascar about Lingana or Umhlonyane. So in South Africa during COVID-19, there were corruption and fraud. People were involved in such corruption and fraud during COVID-19, spending money on PPE and all those things. So that also just brings such a very bad condition of the healthcare system in South Africa. And also still on the issue of COVID-19, we still have an issue in South Africa in terms of doctors that are not trained. I remember during COVID-19, South Africa had to outsource doctors from Cuba, to say that those doctors from Cuba are trained and therefore they should come to South Africa, because they were saying that South Africa is not capacitated with trained doctors to be able to deal with COVID-19. And so that's why they had to outsource doctors from Cuba to bring them to South Africa to assist in South Africa with COVID-19. And then again, recently, it has been indicated in the news that many doctors are still unemployed while they studied, but they still unemployed. And then also the other issue is the infant mortality rate, as I've indicated, that is very high compared to other countries. I spoke about the life expectancy being low. And then the other thing is that there is not enough health facilities. There is not enough health facilities, which is the other issue, especially in rural areas. You'll find that the healthcare facility is very far, or there's not even healthcare facility in that area. You have to catch a taxi to go to the other area to fetch medication. Again, as I've indicated that previously, we did a study on HIV and AIDS people. And again, one of the responses that came out from the participants, we were looking at the reason why the patients are not adhering to the HIV and AIDS treatment. And one of the reasons that they gave was that it's because the healthcare facility is far, and obviously in South Africa there are some people that are still poor, especially in rural areas. And so if you have to collect medication maybe once a month, I'm not sure, the HIV patients, I'm not sure whether they collect the medication once a month or once in 2 months or in 3 months. I'm not sure what is the process now. But then they were saying, if I have to go to the clinic every month to fetch the medication, depending on how many times they have to go and fetch it. I'm poor, I'm earning the social grant money. Sometimes I don't have money, I'm not working. So I cannot be, that's why sometimes I miss medication, because I cannot be able to afford the transport money to go to the healthcare facility that is far to collect the medication. And so that is my reason for not adhering to the medication. So that's some of the responses that came out. And so that creates an issue in South Africa in terms of its healthcare system, as one of that problem of healthcare facilities being far and not being enough. Okay. So now we're going to look at such theoretical perspectives that we're going to use to discuss the institution of health. We're looking at the functionalist perspective. So the functionalist perspective focuses on the functionality of health, on the individual's ability to contribute to society, and thus the deviance of illness as it disallows the individual from contributing to society's function. So according to Talcott Parsons, view illness as a form of deviance, which disturbs society's functioning in just the same way that crime does. So last time I spoke about the functionalist perspective, that it views society as the woman body or the woman organism, that if there are different parts in your body, then you're not feeling okay, it affects your whole functioning as an individual. And so like the society with such various institution, that if there's a dysfunction with one institution, then it affects the entire functioning of the society and affects the other institutions. So now we're talking about health and the individual. As Talcott Parsons indicate that illness is a form of deviance, meaning that it disturbs the society's functioning. If you are a student, you are sick, then you're not going to be able to function very well. You won't be able to come to class because obviously you're not going to be able to concentrate because you are sick, and so you have to take time off so that you can rest. If I'm a lecturer, I'm not feeling well, I'm sick, it means therefore it disturbs my functioning as a lecturer. I cannot be here and talk to you like this because I'm not okay, because I'm not going to be myself. And so that's why Talcott Parsons indicate that illness is a form of deviance and it disturbs society's functioning. Now again, Parsons also discusses the term sick role. Talcott Parsons looked at the term or the concept of the sick role to say that as an individual, when you are sick in the society, you have a role to play and you have responsibilities